Welcome, everyone, and thank you for joining us today on MedLive for Hereditary ATTR Amyloidosis. Know your genetic health history. My name is Mandy Sandcooler, Director of Partnerships and Communications with the Mended Hearts, Inc., and I'll serve as moderator for this session. We're excited to be here to share information with you all about hereditary ATTR amyloidosis, also known as hATTR, which is an underdiagnosed condition disproportionately affecting African Americans. This program is sponsored by Alnylam Pharmaceuticals, Inc. and produced in partnership with the Mended Hearts, Inc. and blackdoctor.org. For our agenda today, we will start with an overview of the Alnylam Patient Education Liaison Team from Nikki Kitchen, an Alnylam Patient Education Liaison. Then we will hear from Giselle, a patient living with hereditary ATTR. Then Dr. Ugochukwu, an advanced heart failure and transplant cardiologist, will review key disease state information about hereditary ATTR. Later, we will talk about the various educational resources at Alnylam, such as ATTR Revealed, and many tools that you can download, as well as information about genetic testing and counseling. There will be time for us to answer questions at the end of this presentation. Throughout the presentation, we welcome you to input your questions in the Q&A box. We'll get to as many questions as time allows. I'd like to thank our panelists for being here today. Now let's get started. Please know that the information in this presentation is intended solely for your educational purposes and is not medical advice. It is not intended to provide diagnostic, clinical, nursing, or genetic counseling advice. All diagnosis and treatment decisions should be made by you and your doctor. And with that, I'll turn it over to Nikki.
Thank you, Mandy. I would like to take a little bit of time to share more about my role as a patient education liaison with Alnylam Pharmaceuticals. Alnylam is a pharmaceutical company dedicated to proving that innovative science, perseverance, and passion can come together to help improve the lives of patients. As part of Alnylam's dedication to patients, we are here to provide education and raise awareness about diseases like hereditary ATTR amyloidosis, commonly referred to as hATTR. Alnylam Patient Education Liaisons, which are also referred to as PELs, P-E-L, are professionals with backgrounds in nursing who can answer your questions about hATTR and provide educational resources to help you and your family learn more about the condition. So you may ask, how can an Alnylam PEL help you and your family? Well, the purpose of the Alnylam PEL team is to provide education to patients, their families, and caregivers. PELs help raise awareness about hATTR in community health organizations, as well as advocacy groups. PELs are employees of Alnylam Pharmaceuticals, and they are not acting as healthcare providers and are not part of your healthcare team. It's important to know that PELs do not provide medical care or advice, and all diagnosis and treatment decisions should always be made by you and your doctor. If you are interested in connecting with an Alnylam PEL, you can do so simply by visiting our website at attrpel.com.
Thank you, Nikki. And now it's time for our first polling question. We'll have a handful of polls throughout the presentation today, and we greatly appreciate hearing from you. Our first question is, how would you describe your current level of knowledge of hereditary ATTR amyloidosis? A, very familiar, meaning I understand this disease well and could explain it to others. B, somewhat familiar, meaning I have heard of it but need to learn more. Or C, not familiar at all, meaning I've never heard of this disease and know little or nothing about it. And while we wait for you all to put in your choices, I'd like to ask you, Nikki, in your experience, how well known is hereditary ATTR in our communities?
Well, Mandy, honestly, hATTR amyloidosis isn't very well known in most communities. In fact, many people, even those with symptoms, haven't even heard of the condition until someone in their family is diagnosed or they are searching for answers themselves. It's often mistaken for other conditions, so raising awareness is extremely important.
Thank you, Nikki. Okay. And now I'd like to introduce Giselle, living with hereditary ATTR, to share her journey with hereditary ATTR. Giselle currently lives in Illinois and is enjoying a well-earned retirement after a fulfilling career in the health insurance industry. Since receiving her diagnosis of hereditary ATTR amyloidosis, she's become a certified health and wellness coach. Her health challenges began around 2002 when she started experiencing symptoms that persisted and evolved over more than a decade. In 2014, her father began showing similar signs and was soon diagnosed with hereditary ATTR amyloidosis. Understanding the genetic nature of the condition, Giselle followed her doctor's recommendation to undergo testing, and in 2018, she received her own diagnosis of hereditary ATTR amyloidosis. Giselle, thank you for being here today. Can you share a bit of your story with
I
us?
sure will. Thank you so much. When I think about the core of who I am, the first thing that comes to my mind is my father. We're similar in so many ways, right down to the shape of our fingernails. I've been a proud daddy's girl for as long as I can remember. He's always encouraged me, loved me, and protected me. Even in his last years during his battle with hereditary ATTR amyloidosis, he protected me. I would like to thank Alnylam Pharmaceuticals for sponsoring me to share my story with you today about living with hATTR amyloidosis. I was born on the south side of Chicago in 1965. My childhood was spent bouncing from house to house on my block as we played double dutch, hopscotch, and other games from sunup to sundown. Everyone back then called me Gigi. So when I hear that nickname now, I know it's coming from an old friend in the neighborhood. As an only child, I was the apple of my daddy's eye. He always worked hard to make sure I knew that. So I remember one day, Mom and I were in the house and we heard this noise coming from the basement. So I ran downstairs. My dad was skating around the skating rink that he had created for me and my friends. Little did we know that he had been taking private skating lessons so he could join me and my friends at the skating rink. That was the kind of dad he was. I loved him for it. And Mom tells people that I'm daddy's baby and mommy's baby. When you look at us, we look like fraternal twins. So as I got older, I stayed close to my family and my neighborhood. I moved on. I did receive my bachelor's in business administration. 20 whole years later, I received a master's in project management. I worked in health insurance for over 2 decades, but I never thought that was my passion. It wasn't until I dealt with the hardest challenges in my life that I realized I needed to change my career. So both me and Dad were pretty healthy most of our lives. You know, we had our issues every now and then, but nothing really concerned us about anything. The year 2002 brought on some health concerns that I didn't realize was going to persist, progress, and change my life over the next decade. It all started with frequent urination. Be at my desk at work, I go to the washroom, come back, maybe 10 minutes later, I would have to go again. And then sometimes it would be very painful. It would be urgent. I feel like I had my bladder would feel like it would burst. So I finally went to the doctor, and they diagnosed me with a condition called interstitial cystitis. They gave me some medication for it. It did not help at all. So as the years went on, other symptoms started to follow. I felt like I was racking up a grocery list of health problems. From 2002 to 2015, I started having severe pain in my arms and legs. I was always constipated. I developed bilateral carpal tunnel syndrome. And these strange bruises would just pop up out of nowhere on my thighs. And of course, the list goes on and on. After a while, Giselle felt like a hypochondriac because I kept having to go see all these different doctors and specialists, and no one could explain what was happening to me. Then I realized at the same time, my dad was going through some mysterious health issues. Like I said, my daddy and I were just alike. He had been seeing multiple doctors for different issues and concerns with breathing, diarrhea, and a few other things. It seemed like no one could figure out what was going on with him either. So one day in 2014, I walked in the house to check up on him. He told me his feet were swollen. So I lifted up his pants leg and I looked down. Dad looked like he was standing on tree trunks. His legs and ankles were so swollen. So, of course, I panicked, took him to the doctor, and that doctor referred him to a cardiologist who ordered some multiple tests to see what was really going on. The test did show that he had amyloidosis, but those doctors weren't sure what type of amyloidosis he had. So after being transferred to another cardiologist about a year or so later, it was the second doctor who put his symptoms together and ordered various tests, including a fat pad biopsy. It was then that he was diagnosed with hATTR amyloidosis, hereditary amyloidosis. When I heard the diagnosis, of course, I was shocked. I wasn't fully sure what this was about for my dad. What did this mean for him? This was the man at age 60, bought some brand new rollerblades and started skating around the neighborhood outside. He was the man who protected me even when I didn't realize it. So we started to put together a game plan for him. And in the rush of figuring out how to take care of my dad, guess what? I forgot about taking care of myself. His doctor did inform me that the condition was hereditary. She explained that it is a gene variant that causes issues with the nerves, the heart, and the digestive system. I knew this condition might be the answer to my symptoms, but I didn't have time to go get tested. I was going to my parents' house almost every day to take care of my dad and my mom. Mom had her own set of health issues. So you can see I didn't have time to worry about me. So 2 years passed and my father's health continued to deteriorate. Even though I had family and friends to lean on, I struggled to keep my head above water. I was watching my dad, my best friend, slip away. During that time, my dad and I continued to remind each other of our connection. I came in that house every day and I said, Dad, you're still my favoriteest person in the whole wide world. And his response to me always was, you're still my little girl. I was devastated when my father passed. I felt alone, overwhelmed, and confused. Even the night he passed, his final words to me were, you're still my little girl. Now my father, my protector, was gone. But little did I know at that time, in his demise, he was still saving my life. So I still had to deal with my own issues at this point. Things had progressed to include shortness of breath, edema, and other symptoms. For so long, I had put my own health on the back burner. After my father's death, his cardiologist called me and insisted that I get a genetic test done for hATTR amyloidosis. At this point, I figured if his doctor had taken the time to remember her patient's daughter, then I better get serious about getting this testing done. I met with the cardiologist. While I was there, a genetic testing company came in and ran my blood work. They provided me with brochures for hATTR amyloidosis for myself and for my family. A couple of weeks later, the results came back positive for hATTR amyloidosis. I can't say I'm surprised. The similarities between me and my dad were no secret. I looked like him, I act like him, and I even think like him. So why wouldn't I have amyloidosis just like him? I remember saying to myself and to the heavens, thanks, Dad. You could have kept this one to yourself. So my doctors talked me through the condition. Together we came up with a better plan to manage it. But when faced with a diagnosis like this, the mind starts to wonder. I started thinking about my beneficiaries. That panic mode came in. I put together all of my affairs, contacted those attorneys. And finally, my girlfriend said to me, Giselle, slow down and remember you're still young. My dad lived to be in his 80s before he passed away. So, yeah, I took a deep breath and I decided moving forward was the best option. All I could do is be as proactive as possible. I started attending webinars and seminars to learn as much as I could about amyloidosis. I remember the very first seminar I attended. I looked around the room and I saw that I was the youngest person there. Then I thought to myself again, my dad is still protecting me. Through his diagnosis, I was able to get diagnosed a lot younger than most people with this condition. Because of him, I knew what I had and I could fight this. I felt blessed because after talking to others with this condition, most people had gone even more years than I had without knowing what was wrong. My dad saved me from all of that. So after all those years of those strange symptoms, it started to make sense. I reached out to every specialist that I had seen throughout the years, and I let them know about my diagnosis. I felt like they needed to be familiar with this condition so that they would know how to treat and diagnose future patients. It was around this time I realized I wanted to follow my passion with my life and my career. I wanted to help people. In all those years of working in health insurance, I realized people don't fully understand their own health issues and how to maintain a quality of life. My journey with amyloidosis has shown me that people need help. I went back to school and became a certified health and wellness coach. Now, not only can I help people through my own experience, I can guide them through their health challenges. I've always been an active person. It has become even more important now that I've been diagnosed with amyloidosis that I need to eat healthy and exercise. So I work out regularly. I still consider myself daddy's little girl, Gigi, who still likes to roller skate and jump double dutch. I try to keep that same little girl mentality and enjoy life. I always tell people when you exercise, make sure you're doing something fun. That way it doesn't seem like work. I know that I can't change my condition, but I definitely can feel strong. My doctors are impressed with my dedication to a healthy lifestyle. I feel lucky to have the healthcare team that I have. I've been seeing my primary care physician for a couple of decades. I know that if I fell out in the middle of the street in front of her, she would know everything about me without even looking it up. I have a great connection with her. I also have a great connection with my cardiologist that I'm seeing. Just to think, she called me personally and asked me to come in and get tested. I'm connected with her as well. I have her cell phone number, so I can contact her anytime I need to. So I talked to my fellow amyloidosians. Yes, I made up the word, we're amyloidosians. They inspire me and show me that hATTR amyloidosis needs more recognition. We are not defined by this condition, but we are bonded by it. I've been bonded with my daddy as long as I can remember. As I said, I talk like him, I think like him, and I definitely look like him. So now I have hATTR amyloidosis just like him. His legacy is not this condition, and mine won't be either. Just like my dad, my legacy will be teaching others how to keep on fighting. And I say to myself daily, fight, Giselle, fight. Thank you so much for allowing me to share my story about living with hATTR amyloidosis.
Thank you so much, Giselle, for sharing your journey with hereditary ATTR. Next, I'd like to tell you a bit more about our HCP expert, Dr. Ugochukwu, advanced heart failure and transplant cardiologist at the Georgia Heart Institute from Georgia Heart Institute, who will review key information about ATTR. Dr. Ugochukwu is a heart failure cardiologist at Georgia Heart Institute in Gainesville and Brazelton. He directs the Left Ventricular Assist Device, or LVAD, clinical program and Northeast Georgia Medical Center's Cardiovascular Disease Fellowship. Since joining Georgia Heart Institute in 2017, he's held key leadership roles, including Chief of Cardiology and Medical Director of the Heart Failure Treatment and Recovery Center. He is also the inaugural Chuck and Debbie Jones Endowed Professor of Cardiology and Medical Education. Dr. Ugochukwu earned his medical degree from Howard University, graduating in the top 10% and inducted into Alpha Omega Alpha. He completed residency and dual fellowships in general cardiology and advanced heart failure transplant cardiology at Vanderbilt University, where he served as chief fellow. Board certified in multiple specialties, he is widely published, an active clinical trial investigator, and a national thought leader with expertise in cardiac amyloidosis, pulmonary hypertension, and cardiac sarcoidosis. Doctor, thank you so much for being with us today. I'll turn it over to you.
Thank you so much. Before we begin our overview of hATTR, I want to let you know that a few things. This event is sponsored by Alnylam Pharmaceuticals. I am a consultant for Alnylam, and I am receiving compensation for this presentation. The program material has been provided by Alnylam. If you have any questions, we will be hosting a Q&A session at the end of this presentation. ATTR amyloidosis, or otherwise called ATTR, is a progressive and underdiagnosed disease with symptoms that can worsen over time and affect multiple parts of the body, including the heart, nerves, and digestive systems. There are two types of ATTR. Wild-type ATTR is not inherited and may be associated with aging. Hereditary ATTR is caused by an inherited gene variant or change in the TTR gene passed down through family members. The gene variant causes the TTR protein to misfold and build up in the body as amyloid deposits. While either type of ATTR can manifest in multiple ways, wild-type ATTR is more commonly associated with heart-related symptoms also known as cardiac symptoms. And hereditary ATTR is more commonly associated with heart-related and/or nerve-related symptoms, which are also called polyneuropathy symptoms. ATTR with heart-related symptoms may be referred to as ATTR with cardiomyopathy, and ATTR with nerve-related symptoms may be referred to as ATTR with polyneuropathy. ATTR with cardiomyopathy, also referred as ATTR-CM, means the buildup of amyloid deposits causes the heart muscle to thicken and makes it difficult for the heart to pump blood to other parts of the body. Cardiomyopathy can lead to heart failure, commonly experienced as shortness of breath, fatigue, weakness, and swelling of the legs, each of which may limit physical activity for patients. ATTR with polyneuropathy, also referred to as ATTR-PN, means the buildup of amyloid deposits damages the nerves affecting sensation, movement, strength, and bodily function, such as digestion, urination, and sexual function.
Thank you, Dr. Igolum. It's time for another poll. We'd like to know from those tuning in, what is your age group? Is it A, under 30, B, 30 to 49, C, 50 to 64, D, 65 or older, or E, I'd prefer not to say? And while we're waiting for people to give us their ages, Doctor, what is the age range for patients that you typically see?
Thank you for that question. So patients with hereditary ATTR amyloidosis, or hATTR, can range widely in age. Some people start showing symptoms as early as in their 30s or 40s, while others aren't diagnosed until much later in life, even into their 70s or 80s. It really depends on the genetic variant and several individual factors.
Okay, thank you, Dr. Igolum. And back to you now, Dr. Igolum.
Thank you so much. So now we will be taking a closer look at the hereditary form of the disease. Hereditary ATTR is a hereditary disease that is caused by a change in a gene. Because this disease is linked to genetics, it is important to first understand how genes and proteins affect the body. DNA is the code that makes up your genes. Genes act as the instructions to make proteins. The differences in the DNA that make up genes is what makes each person unique. Proteins are produced according to the instructions coded in the DNA and are the building blocks of cells and the basis of bodily function. These bodily functions include making up the structure of a cell, transmitting signals within the body, serving as part of the immune system, and transporting multiple substances throughout the body. Genes are made up of DNA and carry information that determines traits and characteristics that are passed down to you from your parents. These genes control how you look, how your body works, including skin, hair, and eye color, and also affect the possibility of developing certain diseases. Sometimes there is a genetic variant or a change within a gene that may affect a health problem. Such genetic changes can be inherited from one or both parents. A genetic change may also occur during someone's lifetime due to environmental factors. In hereditary ATTR, a genetic change that is associated with the disease is inherited and runs in the family. Proteins normally fold in a 3D shape based on the code contained in the gene. Sometimes a gene variant in the genetic code can cause a protein to misfold. Misfolded proteins can be the cause of some genetic diseases like hereditary ATTR. If a protein misfolds, it takes on an abnormal shape. The abnormal shape can cause the protein to function incorrectly and potentially build up or clump together. The buildup of abnormal misfolded proteins in the body are called amyloid deposits and causes symptoms of diseases like hereditary ATTR. Let's take a look at what causes hereditary ATTR. TTR is a protein made primarily in the liver that carries vitamin A and other substances throughout the body. In hereditary ATTR, a variant or change in the TTR gene causes the protein to become toxic to the body by misfolding and taking on an abnormal shape. This abnormal shape causes the protein to build up over time in various parts of the body, including the heart, nerves, and digestive system. The buildup of abnormal proteins is called amyloid deposits. Amyloid deposits damage parts of the body, causing the symptoms of hereditary ATTR, and can affect everyday tasks such as taking the stairs or going for a walk. If one parent has hereditary ATTR, each child will have a 50% chance of inheriting the genetic variant that may cause this condition. A family member may inherit the TTR genetic variant, but having the variant does not necessarily mean they will develop hereditary ATTR. Although someone can be at risk of this disease, it is more common for people of certain ethnicities, such as those of African, Brazilian, French, Irish, Japanese, Portuguese, and Swedish descent. It is important to learn about your genetic health history because it may help determine your risk for this condition. There are more than 120 gene variants known to be associated with hereditary ATTR. Although anyone can be at risk for this disease, it is more common for certain ethnicities. The V122I variant more commonly affects African American patients in their 50s and 60s. Approximately 4% of African Americans are carriers of a V122I variant. Symptoms typically involve the nerves and heart. Nerve damage can lead to communication problems between the brain and the rest of the body, including the arms and legs. This may lead to a range of symptoms, including loss of voluntary movement of the hands and feet and loss of sensitivity to temperature. Heart damage can lead to heart failure. The T60A variant more commonly affects Irish patients in their 60s. Symptoms often involve the nerves and heart. The V30M variant more commonly affects Japanese and Portuguese patients in their 30s into their 60s. Symptoms typically involve the nerves. People of Portuguese descent may experience symptoms at a younger age. 87% of people of Portuguese descent who were diagnosed with hereditary ATTR amyloidosis in one study experienced symptoms before age 40. If your doctor thinks you may be at risk for hereditary ATTR, they may recommend you work with a genetic counselor. We'll explain who they are and what they can provide later on in this presentation. V122I is the most common TTR variant in the United States. When we trace this variant back to Africa, we find that it's most commonly seen in West African countries, including Ghana, Guinea, Ivory Coast, Nigeria, and Sierra Leone.
This is helpful information, Doctor. Thank you. Let's take a moment for another polling question for our audience. And the question is, which of the below best describes your race or ethnicity? And please select all that apply. A, American Indian or Alaskan Native, B, Asian, C, Black or African American, D, Hispanic or Latino, E, Native Hawaiian or other Pacific Islander, F, White, G, other, or H, I prefer not to answer. Doctor, back to you.
The continuous amyloid deposit buildup that is a result of hereditary ATTR can lead to a range of possible symptoms that affect several parts of the body, including symptoms related to the heart, abnormal heart rhythms, or what we may call arrhythmias, irregular heartbeat, shortness of breath, fatigue, fainting, leg swelling, or edema. Symptoms related to the nerves in hands, feet, arms, and legs. Tingling, numbness, burning pain, loss of sensitivity to temperature, loss of movement control, weakness. Symptoms related to control over bodily functions, digestive issues, nausea and vomiting, diarrhea, constipation. Abnormal sweating, recurrent urinary tract infections, dizziness upon standing, sexual dysfunction, unintentional weight loss. Symptoms related to muscles, joints, and tendons, carpal tunnel syndrome, lumbar spinal stenosis, biceps tendon rupture, rotator cuff injury, osteoarthritis, trigger finger. In addition to these symptoms, there are other symptoms associated with ATTR, such as glaucoma, blurred or spotty vision, floaters in the eye. This is not a complete list of symptoms that may be experienced in patients with hereditary ATTR. Each patient has a different experience, and you may not experience all of these symptoms, or you may not experience them at the same time. Because symptoms of hereditary ATTR can worsen over time, it is important to talk to your doctor about them as soon as possible. Carpal tunnel syndrome may be one of the first symptoms of hereditary ATTR that people experience. This condition is common and causes pain, numbness, and tingling in hands, wrists, and arms. A significant number of people have symptoms of carpal tunnel syndrome up to 10 years before they show other symptoms of hereditary ATTR. Carpal tunnel syndrome is hereditary ATTR, often affects both hands, also known as bilateral, and specialized surgery is often required. However, in most people with hereditary ATTR, this surgery may not resolve their carpal tunnel syndrome, and signs of this condition may persist or recur after surgery. Out of approximately 100 people who had carpal tunnel surgery in one study at a health system, 10 people had amyloid deposits, and 7 out of these people had TTR amyloid deposits. 2 of these 7 people then received a diagnosis of hereditary ATTR based on genetic testing, which can help identify the disease. We'll explain genetic testing later in the presentation. Understanding how carpal tunnel syndrome is linked to hereditary ATTR could lead to an earlier diagnosis. If you think you are experiencing carpal tunnel syndrome, particularly in both hands, it is important to start the conversation with your doctor about hereditary ATTR. Hereditary ATTR can affect your health. The symptoms can affect how you live your life as well as engage in everyday tasks, such as using the stairs or going for a walk. In hereditary ATTR, continuous amyloid deposit buildup can cause continued damage that can lead to decline in physical health, reduced ability to participate in social activities, and increased emotional burden. Because hereditary ATTR symptoms can worsen or change over time, if the underlying disease is left untreated, it is important to partner with your healthcare team to get the right diagnosis early and continue to keep track of how you're feeling.
Right. Let's take another moment to hear from our audience. Which of the below options best describes you? Are you A, diagnosed with hereditary ATTR amyloidosis, B, experiencing symptoms of ATTR amyloidosis but not diagnosed, C, a caregiver for someone with hereditary ATTR amyloidosis, or D, a person at risk for hereditary ATTR amyloidosis? This may be you if you have a family member who has the condition, is a genetic carrier, or if you're unsure. E, interested in learning more about the condition but may not have a connection to the disease, or F, none of the above. And while we wait for those responses, how do you think our audience will respond, Nikki?
Well, that's a very good question, Mandy. I honestly think that it will be a mixture. Some people will have a diagnosis, others might be experiencing symptoms but haven't been diagnosed yet. And there will be caregivers and people who are at risk because of family history. Plus, there are always people who are just curious and want to learn more, even if they don't have a direct connection. So I will be very interested to see what the results are.
Thank you, Nikki. All right, doctor, please continue.
If your doctor thinks you may have hereditary ATTR, they may conduct preliminary assessments of heart and nerve function, or may also order imaging studies or laboratory tests to determine the cause of your symptoms. We will talk about some of these more common tests here. Although it's important to note that this is not a complete list and that depending on your symptoms, your doctor may order other assessments. There are also tests that may measure how well your nerves are working. For example, nerve conduction study, also known as NCS, can detect nerve damage. It uses electrodes that test the speed at which the electrical impulses move through the nerves. Electromyography, or an EMG, can detect abnormalities in the nerves and muscles by measuring the electrical activity of muscle in response to nerve stimulation. The following tests measure how well your heart is working. Electrocardiography, also known as ECG or EKG, can detect heart-related conditions. Electrodes are used to record electrical activity and rhythm of the heart. Echocardiography, also referred as to an echo, is a type of imaging that uses ultrasound to visualize the heart structure and measure heart valve function and cardiac muscle strength. Cardiac magnetic resonance imaging, abbreviated CMRI, is a type of imaging that uses magnetic field to visualize the heart structure and determine how well blood flows through the heart. If preliminary tests suggest the possibility of hereditary ATTR, your doctor may perform additional tests. If the preliminary test results suggest the possibility of hereditary ATTR, your doctor may perform additional tests to help confirm the diagnosis, such as genetic testing, from DNA samples like blood, cheek swab, or saliva to detect genetic variants in the TTR gene. Genetic testing is needed to determine if you have wild-type ATTR or W2-ATTR or hereditary ATTR, and if other family members should get tested to understand their own risk of developing the disease. Technetium pyrophosphate scintigraphy, also known as PYP scan, which is a type of imaging and a non-surgical way of detecting amyloid deposits in the heart. A tissue biopsy to identify amyloid deposits in the tissues of the body. If your doctor thinks you may be at risk for hereditary ATTR, they may also recommend genetic testing. Genetic testing is a simple blood, cheek swab, or saliva test that identifies DNA changes that may lead to a genetic condition. Genetic testing can differentiate between hereditary ATTR and wild-type ATTR, also known as WT-ATTR. It can also help determine a person's chance of developing or passing down a hereditary condition. Genetic testing may shorten the time to diagnosis and help prevent misdiagnosis. Knowing about a genetic variant in your family can help you have important conversations with your family and may even serve as a vital piece of information in your family member's diagnostic journey. Your doctor may also recommend you work with a genetic counselor. Genetic counselors are trained healthcare professionals who provide information and support to people who have or may be at risk for genetic conditions. Genetic counselors can work with people who are considering a genetic test and provide guidance after a test. They can also help people understand genetics, inheritance, and disease risk, including a person's risk for inheriting TTR genetic variant and the chances of developing the disease. Counselors can discuss the benefits, limitations, and potential implications of genetic testing. Counselors can also provide information about support and resources, such as patient advocacy organizations. Alnylam Act Genetic Testing and Counseling Program. One option for genetic testing and counseling is through Alnylam Act. Alnylam Pharmaceuticals is sponsoring no-charge third-party genetic testing and counseling for individuals who may carry one of the 120 or more gene variants known to be associated with hereditary ATTR. The Alnylam Act program was created to provide access to genetic testing and counseling to patients as a way to help people make more informed decisions about their health. While Alnylam provides financial support for this program, tests and services are performed by independent third parties. Healthcare professionals must confirm that patients meet certain criteria to use this program. Alnylam receives de-identified patient data from this program, but at no time does Alnylam receive patient identifiable information. Alnylam may use healthcare professional contact information for research purposes. Both genetic testing and genetic counseling are available in the US and Canada. Healthcare professionals or patients who use this program have no obligation to recommend, purchase, order, prescribe, promote, administer, use, or support any Alnylam product. No patients, healthcare professionals, or payers, including government payers, are billed for this program. It's important to work with your healthcare team to get a diagnosis early and talk with your doctor regularly about your condition. There are treatment options available for patients with certain conditions and types of hereditary ATTR that address the underlying cause of the disease. They work by 1. Silencers, reducing the amount of TTR protein in the body, which can help decrease the formation of amyloid deposits. Stabilizers, decreasing the amount of TTR protein that take on an abnormal shape and form amyloid deposits in the body. Because symptoms of hereditary ATTR can worsen quickly over time, managing symptoms is an ongoing process. Work with your doctor to ensure that you are taking the right steps to manage your disease. Having a strong relationship with a doctor who knows how to manage hereditary ATTR can be key to determining a diagnosis. Here are ways to get ready for the next conversation you have with your healthcare team. Prepare a list of your symptoms. Because hereditary ATTR can affect many parts of your body, it is important to be aware of possible signs and symptoms. Even if you've already been diagnosed, let your doctor know about any new or changing symptoms, whether they seem related to each other or not. Gather your medical and health information. Have you and your family's medical history and test results ready. Additional data from your health tracking devices or apps like activity level trackers or heart rate monitors can help with assessments during your visits. List all your medications. Maintain a list of your current and past medications, especially if you've taken medications for heart failure that may not be improving your condition. Ask key questions. Continuing in-depth conversations with your doctor will help you know what to expect and establish how you can best work with each other. It's important to prepare a list of key questions that you would like to ask ahead of your appointment.
Great, thank you. And here's our final polling question. We'd love to hear what prompted you to attend today's webinar. Was it A, a recent diagnosis or symptoms, B, family history of hereditary ATTR amyloidosis, C, caregiving responsibilities, D, general education or interest, or E, a recommendation from a healthcare provider? And doctor, we really appreciate this disease overview you've given. I'm now going to turn it over to Nikki to review some additional educational resources.
Thank you again, Mandy. Well, whether you are learning more about hATTR, have recently been diagnosed, or are living with ATTR, scan the QR code on your screen or visit attrrevealed.com to uncover more information. In addition to the information on the site, you will also have access to downloadable materials like an educational overview brochure, as well as a symptom tracker and checklist to support you in your journey with hATTR. Lastly, you can also find a list of foundations and resources dedicated specifically to supporting patients living with ATTR and their caregivers. One question that we often receive is, how can I find a doctor that manages the disease? On the ATTR Rebuild website, we have a doctor directory that contains information about healthcare professionals who have given Alnylam permission to share their information and have told us that they have experience in managing ATTR. So you can simply scan the QR code on this screen as well, and it will take you directly to the doctor directory. Additionally, it is available on attrrevealed.com. In this directory, you can search by zip code to find a doctor that is close to you. And as a reminder, we have the Alnylam Patient Educator Liaison. So the Alnylam Patient Education Liaisons, also known as PALs, is a great resource to answer questions about ATTR for you and your family members. You can do so by visiting www.attrpel.com if you're interested in connecting with a PAL, or scan the QR code to submit a request for an Alnylam PAL to connect with you. PALs are employees of Alnylam Pharmaceuticals, and as a reminder, they are not acting as healthcare providers and are not part of your healthcare team.
Okay, thank you so much for that information. Now we've come to our Q&A session. So if you haven't already, please submit your questions in the Q&A box and we'll get to as many questions as time allows. So let's just take a look. Question 1 is for Nikki. Nikki, what support is available for patients who've been diagnosed?
Well, there are a number of support options that are available. Patients can go to the attrrevealed.com website. And at that website, there is a location for resources and support. And there people can find information on the Amyloidosis Foundation, Amyloidosis Support Group. There's also the My Amyloidosis Pathfinder that can be utilized as well. In addition, there are hospitals and different clinics that have educational programs and community groups, and the patient education liaisons are also available to connect with patients and their families and caregivers to provide additional support and education as well.
Great, thank you so much. Question 2 is for Dr. Golem. What types of doctors should be involved in care? Neurology, cardiology, genetics, etc. And how does someone find an experienced hereditary ATTR center or specialist?
Excellent. Thank you so much for that question. As we described earlier, amyloidosis affects multiple organ systems or body parts, pretty much I would say from head to toe. So heart, nerves, kidneys, legs, you describe it. So really for appropriate care, each patient really needs a multidisciplinary team. A heart doctor for sure that will address any heart involvement, a neurologist who can appropriately evaluate and treat any nerve symptoms, make an appropriate diagnosis. If the patient has a lot of other symptomatology, for example, renal failure, they may need to see a nephrologist. Or if they have eye manifestations, so they may need to see an ophthalmologist. So really, depending on the symptoms the patient has, they'll need to see the appropriate physicians as part of that care team. But I think at the core, if there's heart involvement, a cardiologist should be involved, and a neurologist if there's nerve involvement, and that's sort of the core team that's involved. I think earlier, Nikki pointed out the QR code that one can scan, and also the website that you can go to, and using your zip code, you can be able to find appropriately trained clinicians who have a lot of expertise in managing these patients. It's a really wonderful resource, and that is where I would refer folks to go to identify physicians and clinicians in their area that have expertise in managing their disease process.
Great, thank you. Question 3 is back to Nikki. Where could someone find support groups or talk to other people who are living with hereditary ATTR?
Again, I would refer people to the online directories, which are available at attrrevealed.com. There's Amyloidosis Support Group, Amyloidosis Foundation, and My Amyloidosis Pathfinder. These are just some resources to help people find support groups that may be available. And again, you can follow up with the ATTRPEL.com website if you're wanting to connect with a PEL for more education. But there are support groups that are available utilizing those resources, and ATTRrevealed.com is one of the best resources that's available to help connect you with some of those support groups.
Thank you. Back to Dr. Golem for question 4. This is a great question. If hereditary ATTR runs in a family, who should get tested? When should they get tested? And what does that genetic counseling journey look like?
Excellent. Thank you for that question. So firstly, who should get tested? So generally, we recommend testing of all first-degree relatives of that individual who's been diagnosed. So if a mom's diagnosed, naturally her children, if she has children, should be tested. Same with a father. If it's a sibling that's diagnosed, we would recommend the siblings and parents and children be tested. So really, as we noted earlier, there's a 50% chance that this gene passes on within the lineage of that specific individual. So those are the folks that we would recommend getting tested. Of course, there's a conversation that needs to be had. Not all potential patients want to know about their genetic status. So we would recommend they get tested, but I would recommend that person firstly meet with a clinician who has expertise in this disease, talks through the disease process, what's involved, how do we make a diagnosis, get a sense of what symptoms they should be having, could have, and some education, and then make an informed decision about testing and things that come with that. Now, genetic counselors, as we noted earlier, are very important members of our clinical care team, as they're able to provide education around genetics. What does it mean? What are the implications? How do we get other people tested, and what patients can look out for? So really, I think it's important that they be part of the care team. And the genetic counselor would be able to talk with the patient and really explain in detail, if I have this gene, what's the chances that my child or my sibling may have it? And then allows for better family communication and discussion around the disease process. And I think just leads to a more informed process in terms of discussions that are ongoing.
Thank you so much. That's a great answer. And I think we've got time for one more question, question 5 for Giselle. Giselle, how did genetic testing help in your family's journey with hereditary ATTR? And then this will, like I said, be the last question.
Thank you so much. So it has helped. When my dad got diagnosed, that's why his provider called me and asked me to come in and get tested. So as soon as I got tested positive for the gene variant, I connected with all of my first cousins, because he only has one living sibling right now, and let them know about my diagnosis, and have pushed them and encouraged them to go ahead and get tested to see if they have the gene variant so they can move forward with treatment.
Thank you, Giselle. Appreciate that. And with that, we've come to the end of our time together. I'd like to take this opportunity to thank Nikki, Dr. Golem, and Giselle for providing an amazingly detailed overview of hereditary ATTR, including how the disease is inherited, symptoms of the disease, and the importance of early diagnosis. A special thanks to Alnylam for sponsoring the session, and to the Mended Hearts Inc. and blackdoctor.org for their partnership. Most importantly, I want to thank you for joining us. Our hope is that this information is helpful to you to have open and meaningful conversations with your family members and doctors about this condition. So take care, stay safe, and be well.